Greetings, and thank you on behalf of Commissioner Gene Brown with the Alabama Department of Senior Services. My name is Nick Nyberg, and I am the Programs and Planning Division Chief with the Alabama Department of Senior Services. Before I get started on the purpose of this town hall, Commissioner Gene Brown will bring greetings. Commissioner?
Thank you, Nick. Hello, everyone. I'm Jean Brown, and it is my great privilege to serve as the Commissioner of the Alabama Department of Senior Services. Thank you for joining us for this virtual town hall for the new state plan on aging. While this is not how we would typically host a meeting to seek your input on our new state plan, the current coronavirus pandemic necessitates innovation to continue doing our work and protecting our citizens. I hope you will find this town hall video informative and helpful. Most of all, we need to hear from you. At the end of this video, you will find an email address and a mailing address for you to send your comments, concerns, and questions. Please know we will read every one of them and take your comments into consideration as we prepare this new state plan. Thank you again for taking the time to watch this virtual town hall. I will now turn it back over to Nick.
On behalf of the entire State Department, welcome to the State Plan on Aging Town Hall. Today, we are presenting to you the purpose of the 2021 through 2024 State Plan on Aging and how you can help. We want any senior citizen, person with a disability, caregiver, or anyone else listening to this recording to join the conversation and tell us about unmet needs in your communities and suggestions on how your needs can be better met because you are important to us. As shown on the agenda, I will first give the background and overview of the Older Americans Act of 1965, the Alabama Department of Senior Services, and the Area Agencies on Aging, so you will have an understanding of the background of how we, the Alabama Department of Senior Services, exist in the state providing home and community-based services for older adults, persons with disabilities, and caregivers. Secondly, I will be presenting on the 2021 through 2024 State Plan on Aging purpose, demographics, focus areas, goals, and objectives. Finally, I will present on how you can help us for the purpose of the needed public input for this plan. Now for the overview. The Older Americans Act. Congress passed the Older Americans Act, or as we call it, the OAA, in 1965 in response to concern by policymakers about a lack of community social services for senior citizens. Because of the Older Americans Act, home and community-based services for not only older persons but also for persons with disabilities and even caregivers was born. These programs and services are not only necessary to meet the current and future needs of all senior citizens, persons with disabilities, and caregivers, but are even more integral today because of the challenges the aging community will face throughout the state and the country as the population continues to drastically increase. The Older Americans Act gives guidance regarding who to serve, so we at the Alabama Department of Senior Services ensure that preference of services will be given to senior citizens, persons with disabilities, and caregivers with the greatest economic and social need, with specific attention to low-income minority individuals and senior citizens residing in rural areas. Many older Alabamians fall into more than one of these categories, making them particularly vulnerable. The Alabama Department of Senior Services. The Alabama Department of Senior Services, also known as ADSS, was created as the single state agency for receiving and dispersing federal funds made available under the Older Americans Act of 1965, and to serve as the lead agency on programs for the aging population. Since its inception, the Alabama Department of Senior Services has worked diligently to provide for and protect older Alabamians as Alabama is home to nearly 700,000, based on the 2010 U.S. Census, senior citizens 65 and older, and steadily increasing. At the Alabama Department of Senior Services, we believe it is vital to educate the public, lawmakers, and any other agencies or individuals whose focus is helping those in need for the purpose of helping senior citizens and persons with disabilities to lead independent, meaningful, and dignified lives in their own homes and communities for as long as they desire. Area Agencies on Aging. In the state of Alabama, there are 13 Area Agencies on Aging providing Older Americans Act programs in all 67 counties in the state that serve senior citizens, persons with disabilities, and caregivers. An Area Agency on Aging, also known as a AAA, is a public nonprofit agency designated by the state to address the needs and concerns of all older persons, including, under certain programs, persons with disabilities and caregivers at the regional and local levels. AAAs coordinate and offer services that help older adults and persons with disabilities remain in their homes. By making a range of options available, AAAs make it possible for older individuals to choose the services and living arrangements that suit them best. Every AAA in the state is a Certified Aging and Disability Resource Center, also known as an ADRC, which is a trusted source of information where people of all ages, abilities, and income levels, and their caregivers can go to obtain assistance in planning for their future long-term service and support needs. Through a AAA ADRC, people can receive counseling on state and federal benefits, information on all AAA home and community-based service programs, and any other national, state, or local resource that can assist them with staying home and in their communities. Besides being able to receive counseling through an ADRC on benefits like Social Security, Medicare, Medicaid, Veterans Administration benefits, or any other aging resource, AAAs offer the following services funded through the Alabama Department of Senior Services: Senior Center meals, home-delivered meals, transportation services, legal assistance, homemaker services, personal care services, chore services, adult day care services, case management services, medication assistance, state health insurance assistance program for any Medicare needs, senior Medicare patrol to combat Medicare fraud, senior community service employment program for older individuals looking to enter the workforce, disaster preparedness, ombudsman advocacy services for those residing in long-term care and assisted living facilities, and education programs that promote healthy living and healthy aging to develop skills to prevent falls, manage chronic conditions, depression, medications, and the stress of being a family caregiver. Purpose. The State Plan on Aging serves multiple purposes. Document that enables specific funding for senior citizens, persons with disabilities, and caregivers to flow to the state. Develops key strategies to address the strong desires of the rapidly growing population of people who desire service in their homes and communities. Describes expected outcomes of the state's long-term care reform efforts. Translate activities, data, and outcomes into proven best practices. And provides a blueprint that spells out the ways the state will implement the Older Americans Act. Demographics. Alabama is home to approximately 1.9 million people 60 years of age or older. That accounts for 22% of the state's population, with 657,792 being 65 and older. There are approximately 775,000 persons with disabilities of any age, with 322,026 of that number at 65 years of age or older. There are also approximately 1.3 million caregivers providing some type of care for older adults and or persons with disabilities in the state. The University of Alabama Center for Business and Economic Research projects that the senior citizen population in Alabama will increase 83% by the year 2040. Alabama's older population continues to grow rapidly each year, with many who are low income residing in rural areas, and they are living longer with more complex and chronic health conditions. With this tremendous growth and steady increase in the population, and because dignity, independence, and individual choice is of great importance. Alabama faces a challenge because of a lack of and strain on current resources that are needed to care for the aging and persons with disabilities so they can stay in their own homes and communities. Focus areas. This state plan on aging is being compiled with needed guidance and input from the Administration for Community Living, partners that include the 13 area agencies on aging, and the public to help all programs and services take shape long term so we can continue to care for those in need, especially the vulnerable. Over the next 4 years, the Alabama Department of Senior Services will concentrate on the focus areas outlined by the Administration for Community Living. These focus areas are Older Americans Act core programs, Administration for Community Living discretionary grants and other funded programs, participant-directed person-centered planning, and elder justice. Within these focus areas, the Alabama Department of Senior Services will pay attention to strengthening critically needed services as the older individual and persons with disabilities expanding population needs help, targeting more caregivers to support, integrating and improving coordination between programs and partners, supporting participant-directed person-centered planning, and protecting the rights of vulnerable adults and preventing abuse, neglect, and financial exploitation to the extent possible. It is important for the state of Alabama to develop this proposed action plan to address the unmet needs of this growing population. In the end, when the needs of older individuals, persons with disabilities, and caregivers are left unaddressed, they often lead to more expensive institutional care as opposed to more affordable home and community care. Goals and objectives. I will present to you the 6 goals and objectives the Alabama Department of Senior Services has set for the next 4 years. The many strategies and projected outcomes we created encompass all current services offered throughout the state with potential for new grant programs while addressing partner collaboration and coordination, integration, strengthening, supporting, expanding of programs, also while providing continuous outreach and marketing, training, quality assurance monitoring, and accountability of spending. Goal 1. Help older individuals and persons with disabilities live with dignity and independence. Objective 1. Promote and support service provision and sustainability of OAA programs. Goal 2. Ensure that older individuals and persons with disabilities have access to services to assist with daily living. Objective 2. Promote, advocate, and support service provision, sustainability, and expansion of ACL discretionary grant programs and other funding source programs. Goal 3. Population served through all programs will be able to direct and maintain control and choice in their lives. Objective 3. Continue to integrate and support a person-centered approach in all aspects of the existing service delivery system. Goal 4. Consistently advocate for and promote rights of older Alabamians and work to prevent their abuse, neglect, and exploitation. Objective 4. Continue strengthening the Council for the Prevention of Elder Abuse and the Long-Term Care Ombudsman Program to ensure that all Alabama residents are protected from harm. Goal 5. Ensure the state of Alabama is taking a proactive approach in detecting challenges and seeking opportunities to help people live where they choose with help from home and community-based programs. Objective 5. Work jointly with government and partners in identifying ways to maximize available resources in regards to combating challenges faced in the state for the greatest possible impact on the health and well-being of those we serve. Goal 6. Support proactive, accountable, and progressive measures within the planning and management of programs. Objective 6. Provide quality service and technical assistance to the state AAAs, ensuring social aging programs and services are best practices in the state. And finally, public input. Dr. Ralph Nichols, the father of the study of listening, said the most basic of all human needs is the need to understand and be understood. The best way to understand people is to listen to them. Today, the Alabama Department of Senior Services is seeking input from the public to assist with determining the unmet needs of older adults, persons with disabilities, and caregivers in Alabama to better inform our state planning process. We believe community participation is key in identifying unique needs across the state and should be incorporated into the plan development process. We welcome your voice as your feedback makes it possible to craft a plan that's truly considerate of the needs and unmet needs of older Alabamians, persons with disabilities, and their caregivers. Working together can help expand funding and services in all communities across the state so older adults and persons with disabilities can live with independence and dignity in their own homes and communities. If you are a concerned citizen, a public official, a partner, or a provider that works with those we serve in the state, we want to hear from you as well. Your input is confidential and will be used for completion of the 2021 through 2024 State Plan on Aging prepared by the Alabama Department of Senior Services. Please email your comments to state.plan@adss.alabama.gov or mail your comments to Alabama Department of Senior Services. Attention, State Plan on Aging, P.O. Box 301851, Montgomery, Alabama 36130. Deadline for submitting your comments is Wednesday, May 13th, 2020. Thank you.